Hello everyone, myself Dr. Shubhangi Sharma and my topic is Ayurveda and allergic sinusitis. So what is sinusitis? Sinusitis is also known as rhinosinusitis. It means that in this situation there is inflammation of mucous membrane that lines the sinuses. What are the sinuses? There are four types of sinuses: frontal sinus, thymoid, sphenoid, and the largest one is nasal sinus. These are called as paranasal sinuses. So, inflammation of the mucous membrane of these sinuses can lead to sinusitis. So, what are the symptoms of it? Thick nasal mucus, plugged nose, and facial pain. So, what are the purpose of these sinuses? It humidify and warm the inspired air, regulation of intranasal pressure, and increases the surface area for olfaction. It lightens the skull and resonance, and it also absorbs the shock, and it contributes to the facial growth. So, what are the types of it? According to location, there are four types, but according to duration, it is also four types. The first one is acute. It means that inflammation infection that lasts up to 4 weeks, and recurrent or acute. It means that the four or more full periods of episode of acute sinusitis that occur within a year. Subacute infection that lasts between 4 to 12 weeks, and chronic sinusitis infection lasts more than 12 weeks. So, what are the causes of sinusitis? It may be viral, bacterial, fungal, allergic, and medications like HIV and steroids, any kind of nasal polyp, and due to dehydration also. So, what is the pathogenesis of it? In human, if a person get common cold, then mm, after that there is inflammation of nasal mucosa, blocks the sinus drainage, which impairs the mucociliary clearance. So, after that, nose blowing propels nasal secretion to paranasal sinuses, which leads to sinusitis. It means that if a person got common cold, which is known as rhinitis, after a period of while, that person's sinus membrane got infected, then the inflammation of sinuses occur. What are the symptoms of it? Mainly, the runny nose with a thick yellow or green mucus, stuffy nose, post-nasal drip, mucus dripping your head, facial pressure, particularly around your nose, eyes, forehead, and this gets worse when you move your head around or bend over. Pressure or pain in your teeth, ear pressure or pain, fever, bad breath, or bad taste in your mouth, cough, headache, and tiredness. And the sinusitis is an inflammation that leads to it, so there is a headache also, fever, rhinitis, and chills. So, what are the investigation? Firstly, the healthcare provider need to check nose, ears, and throat for any kind of swelling or drainage or blockage with the help of endoscope with a small lightning. So, after that, imagining X-ray, PNS, CT scan, and MRI. Nasal endoscopy is the best investigation in it. Then after it, you can also do allergy testing, rarely biopsy of nasal polyp. So here are the pictures of healthy maxillary sinus and diseased maxillary sinus. Both specifies clearly. So in Ayurveda, if a person get pratishaya, if it is not treated properly or not treatment properly, then it leads to the complication of dust pratishaya, which is known as sinusitis in today's term, which also leads to complications like put nasa, nasa pak, nasa arbut, nitro, khalitya, arjun, shwas, jwar, andhit, and badhirta, etc. In pratishaya, it is above the neck diseases. It means that in dush pratishaya, it affects the above neck organs like eyes, nose, ears, and all. So, as the Rasayan therapy, it is a good immunomodulator. It manages or it increases the immune system so that it manages the pratishaya and other allergic disorders. You can also do steam vaporizer, gel neti, warm facial packs is kind of a Sweden. Keep yourself hydrated, rest, sleep, avoid cigarettes in extremely cool and dry air. Ayurveda treatment. As we told that above neck, it means that Nasa hi Shirso Dwaram. According to Acharya Charak, Nasa is the entry to the brain. It means that above neck diseases can be cured by using or by applying therapies to the nose. So nasal diseases are best treated with Nasya and Dhumpan. So what is Nasya and Dhumpan? Panchkarma and Sanitis, Mukhabhyang. In Mukhabhyang, this is a therapeutic massage focus on the nerve points of vital points and facial muscles, aiming to relieve the tension or detoxify and revitalize your facial tissues. It is an applying of a warm oil to your face which vitalize your facial tissues or it detoxify and it improves the quality of fa- organs also. Sweden. Example is steam inhalation. Dropping of a mixture of a camphor and methanol can be added in a steam, and after mukhabhyang, you can do it Sweden. And then Nasse, dropping of a oil to both of the nostrils is known as Nasse. It can be a Shirovirechan also and Nasse. Two types of Nasse are there according to Acharya Shushruta. So in Nasse, there is a Pratimarsh Nasse in which told that we need to apply oil to both nostrils daily after bath, which is known as Pratimarsh Nasse. Dhumpan. Dhumpan with a Hydra chun. It emulsify helps to reduce the cough in the sinuses and clear the nasal passage. Cavalgre, holding a fluid inside the mouth and oil pulling. And after a period of while, we can pull out all the oil or the material we are using in our mouth. How to do Nasya? In Ayurveda, Nasya is considered the ultimate treatment for addressing body imbalances above the shoulder, which we have already discussed about like the most of the diseases you can good treat it with the help of Nasya. It balances the doshas. This treatment begins with your head, face, and neck and being massaged the warm oil. Then exact dose of Nasya is poured gently into your nose. Mukhabhyam, Sweden, Nasya, Kavalke, and Dhumpan. These are the pictures of how to do Nasya. This is a Mukhabhyam. We need to a Mukhabhyam for 5 to 10 minutes with a warm oil all over face. Then we need a steam inhalation which generally dravigrin the doshas, and after that we do nasya. Nasya, after that we just drop two or drops of oil in both nostrils, and then we do dhumpan with a varti so that it releases or it removes the remaining cough dosh with the help of it. Then after that the remaining dosh which is in your hand doing kavalgre, it expel out by doing an holding of a oil in your mouth. How Nasya act? Nasya Shrotoshodhan, clearance of sinus ostia, which we already discussed that doing Nasya Shodhan of doshas occur. After that, Dravikaran Vilyan, it means Chedan of Dusht Kaf and drainage of retained discharge in sinuses. Dusht Pratishaya Shodhan, by removing the excess cough of due to it. There is an exam pranayam for sinusitis. Calming breath. This breathing technique has a calming effect on the body that helps to relieve out the sinus pressure. Belly breathing. Start with lying on the back, knees bent, and hands on the belly. Slowly start breathing deeply. Concentrate on the belly, expanding while inhaling as well as exhaling. Breathe for fire. In this pranayam, the person has to breathe out forcefully a couple of times, and the breath should be form of navel that makes the belly pump in or out. Start with a slow and then gradually increase the pace of breathing. It generally increases or soothes your calming process of breath. Jalniti. Jalniti rinses out the dirt and bacteria. Jalniti helps to drain dead end passage like sinuses. The eustachian tube receives the same effect as sinuses. So, what are the diets in Sinusitis? कटु अम्ल लवण रस, स्निग्ध उष्ण लघु भोजन, which generally द्रवी द्रवीकरण of दुष्ट कफ, पुराण यव, शाली, कुलत, मुग्धयूष, ग्राम्य, जांगल मांस रस, शिग्रु, करकोटक, लहसुन, वारुणी जल, त्रिकटु. So, what we have to avoid? Vague dharan. We have to avoid vague suppression of urges, growth, anger, atidrav ahar, more liquid diet, and bhumi share. Take a home message. Sinusitis is a small disease with a big discomfort. It hampers our daily routine, makes the mind clumsy. The best message management for Ayurveda is necessary, and many diseases are used selectively according to Prakriti and symptoms. Thank you.